So first let's talk about absorption. So absorption is a process how the drug gets into the body. And obviously where we always measure the drug is in the circulation, in the plasma. So how does it get there? Well, it depends on how you administer it. A lot of times you're going to give a tablet. So you're going to swallow a tablet, and obviously this needs to pass through the GI tract. Then it's going to be absorbed through the portal vein into the liver, and then from the hepatic vein into the circulation. So this is going to take a bit, and you can also imagine not all the drug will probably reach the systemic circulation, because there's going to be some drug that is already destroyed by the stomach acid. And then there's another very important metabolism happening in the liver, which is called the first pass metabolism. And so what that means is that in the first pass, so even before getting into the circulation, there can be already some drug metabolized and excreted before even reaching the circulation. And the liver is mainly responsible for that. But that could also happen already in the enterocytes from the GI tract. So first pass metabolism is an important fact to consider if you give drugs orally. Now, if you give drugs IV, we would directly inject it into the circulation. And then obviously we're going to skip the GI tract and the liver. Now, one very important determinant of absorption is bioavailability. And bioavailability is defined as a fraction of administered dose that reaches the systemic circulation. So the bioavailability, and this is a lot of times abbreviated as F, tells us a lot about what actually reaches the systemic circulation. Now you can already guess, if I administer a drug IV, the bioavailability is going to be 1, because 100% is going to reach the systemic circulation. If I give a drug orally, it can vary a lot, but probably it's going to be significantly below 1, maybe around 0.7 or something like that, depending on the first pass metabolism and other factors. So when we are thinking about absorption, we want to think about how does a drug get into the systemic circulation, because what we measure is the plasma concentration, so P for plasma, in the plasma. So that's what we measure, and that's what matters, which means whatever we get in the plasma depends on the route of administration. And a very important characteristic to talk about this is the bioavailability. So this gives us a measure of how much did we get into the circulation.